Then about that breaking news this lunchtime of a fifth vaccine, Johnson & Johnson making that announcement at 1 o'clock this afternoon. The vaccine's understood to be one of the cheapest at around £7 per dose. Just one dose is required, although trials of 2 doses are ongoing. Well, the vaccine can be kept refrigerated between 2 and 8 degrees Celsius for up to 3 months. And the UK has secured 30 million doses of the jab, while the United States has made a deal for 100 million and the EU has secured 200 million. Well, let's bring in our science correspondent, Thomas Moore, who joins us now. It's like waiting for a bus, isn't it, Thomas? Wait for these vaccines and then 2 come along in one day.
Yes, this is the second wave of vaccines which is coming through. And the thing that really makes this, separates this from the rest is that this is a single-dose vaccine, the first single-dose vaccine, and it does get pretty good results. Not as good, perhaps, as the results we've heard from Novavax in the last 24 hours, but nevertheless, a hugely significant leap forward. So what they've shown is that in the United States, where they did a huge trial, 72% of people were protected from moderate to severe COVID-19. They also tested it, interestingly, in South America and in South Africa, and they got good protection there. So in Latin America, it was 66%, South Africa, 57%. That's where, of course, we've got new variants of the virus emerging, and the fact that it does get still pretty good levels of protection there, better than the flu vaccine would, for example, against the flu virus, does show that this is a decent vaccine. Now, why is one dose significant? Because it can be rolled out so much more quickly that you could extend this far into low and middle income countries very rapidly. They have hardly had any doses of the vaccine so far, and it's at low cost, £7 a dose to protect somebody, and that's roughly the same as 2 doses of the Oxford vaccine. So very significant that this has achieved its initial goal of 1 dose being effective, but as you say, 2 doses are being tested in further clinical trials.